Hey everyone, welcome back to the channel. Today we're talking about a very common and often misunderstood condition, gout. If you've ever had sudden severe pain in your big toe or another joint, you might already know how painful it can be. But what exactly is gout? What causes it? And how can you manage or prevent it? Let's break it down in simple terms. Gout is a type of arthritis. That means it causes swelling and pain in the joints. But unlike regular arthritis, gout comes on very suddenly. 1 minute you're fine, and the next, your toe feels like it's on fire. That pain, it's caused by sharp crystals of uric acid building up in the joint. Uric acid is a natural waste product that forms when your body breaks down substances called purines, which are found in certain foods and drinks, as well as produced by your own cells. Normally, uric acid dissolves in the blood and travels to the kidneys, where it is filtered out and leaves the body through urine. This process helps keep uric acid levels balanced and prevents any problems from occurring. However, sometimes the kidneys can't remove enough uric acid, or the body produces too much of it. This imbalance can be caused by genetics, certain health conditions like kidney disease, obesity, or even by eating foods high in purines, such as red meat, seafood, and sugary drinks. When uric acid builds up in the bloodstream, it can start to form sharp, needle-like crystals in the joints. These crystals trigger inflammation and cause sudden severe pain. This condition is known as gout, and it can develop quickly, often overnight. The most common symptom is intense pain, swelling and redness in the big toe. But gout can also affect other joints like the ankle, knee, or fingers. The affected area may feel hot and very tender, making it difficult to move or even touch. Recognizing these symptoms early is important for proper treatment and relief. Gout is a condition that can potentially affect anyone, but certain groups of people are at a much higher risk. For example, men over the age of 30 are more likely to develop gout, as are women after they go through menopause. Being overweight or obese also increases your chances, since excess body weight can lead to higher levels of uric acid in the blood, which is the main cause of gout attacks. Diet plays a significant role as well. People who frequently eat foods rich in purines, such as red meat and seafood, are more likely to experience gout flare-ups. These foods can cause the body to produce more uric acid, which then builds up in the joints. Drinking sugary beverages like sodas and consuming alcohol, especially beer, can also raise uric acid levels. These drinks not only contribute to dehydration, but also make it harder for your body to eliminate uric acid efficiently. Certain health conditions can make you more vulnerable to gout as well. High blood pressure, for instance, is a common risk factor, and people who struggle to keep their blood pressure under control may be more likely to develop gout. Diabetes and kidney disease are also linked to a higher risk, since both conditions can interfere with the body's ability to process and remove uric acid, leading to its buildup in the bloodstream. Family history is another important factor. If someone in your immediate family, like a parent or sibling, has had gout, your own risk is significantly increased. Genetics can play a big role in how your body handles uric acid. If you fall into any of these risk groups, it's a good idea to talk to your doctor about ways to lower your chances of developing gout and to be aware of the symptoms so you can catch it early if it does occur. Imagine waking up in the middle of the night with a joint, usually your toe, that's swollen, hot, red, and feels like it's being stabbed. That's a gout flare. It usually hits fast, and honestly, the worst pain happens in the first 24 hours. Even a bedsheet touching it can feel unbearable. The good news is, gout can be treated and even prevented. For a sudden attack, doctors may give you pain relievers like ibuprofen, colchicine, which is a medicine that targets gout pain, or steroids to reduce inflammation. If you have frequent attacks, your doctor may suggest daily medication like allopurinol to lower your uric acid levels and prevent future flares. Yes, here's what you can do. Drink plenty of water, eat fewer high purine foods like organ meats, red meat, and seafood. Cut back on alcohol and sugary drinks. Stay active and maintain a healthy weight, and of course, take your medications as prescribed. Gout may be painful, but it's also very treatable. Many people are surprised to learn that with the right approach, gout doesn't have to control your life. Early diagnosis and proper management can make a world of difference, helping you avoid future flare-ups and long-term joint damage. With the right medical care and lifestyle changes, Most people with gout can live normal, pain-free lives. Simple steps like staying hydrated, eating a balanced diet, and keeping active can all help reduce your risk of attacks. Regular checkups with your healthcare provider are also important to monitor your progress and adjust your treatment plan as needed. So if you or someone you know is struggling with joint pain, don't ignore it. Talk to your doctor and take action early. Addressing symptoms sooner rather than later can prevent complications and help you get back to doing the things you love. Remember, you're not alone. Support and effective treatments are available. If you found this video helpful, give it a thumbs up. And don't forget to subscribe for more simple health explainers. We're dedicated to making health information easy to understand so you can make informed choices for yourself and your loved ones. Drop your questions in the comments. We're here to help. Whether you're curious about gout, have concerns about your symptoms, or just want to share your own experiences, we'd love to hear from you. Your questions might even help others in our community. Thanks for watching and take care of those joints. Remember, small steps today can lead to healthier, happier tomorrows. Stay proactive, stay informed, and keep moving forward.